Hello, teachers and students. I'm Meng Qing from Shanghai University of Sports, China, and the topic of my report today is analysis on health communication strategies in the era of social media for the Olympic Games, taking the Beijing 2022 Winter Olympics as an example. And I will introduce it from the following four parts: abstract, main concepts. This part mainly includes the social media era and the Olympics health communication, and the analysis of communication strategies and conclusion. I will introduce the first part is abstract. The research background includes, first of all, the particularity of the international environment. Under the COVID-19 epidemic, there is a special international environment. The suspicion of many large-scale sports events and the raise of attention to health topics. But the Beijing 2022 Winter Olympics can be successfully held in the such circumstance. Second, the International Olympic Committee has also highlighted the role that sport and the Olympic Games can play in promoting healthy and active lives. Finally, the relevant developed strategies of our country are put forward, such a country strong on sports and healthy China. Besides, during the Olympic Games, social media as a global public field in communication is a necessary means of communication for large-scale Olympic Games and even large-scale sports events, and plays a unique role as a medium. Therefore, it's of great significance to study how to use social media to effectively carry out Olympic health communication in the era of new media. Through literature analysis and case analysis, this part first defines Olympic health communication, analyzes the communication content of the social media platform of the Beijing 2022 Winter Olympics, puts forward the prospectus for future Olympic health communication, and it also forwards some reference communication suggestions for future large-scale sports events to carry out relevant health communication through new media. And next is the second part, concept elaboration. First of all, in terms of the definition of social media, Antonio Mayfield mentioned in his 2008 electronic publication, "What is social media?" that social media is understood as an interactive platform that gives people great freedom. And he summarized the characteristics of social media into 6 points, which are participation, openness, communication, dialogue, community, and connectivity. Based on these 6 characteristics, social media platforms are the most effective medium for Olympics health communication. For China, the most popular social media platform in recent years is Weibo. Since its birth in 2010, Weibo has played an increasingly important role in the process of information dissemination and has a huge process of information and has a huge audience. According to the 2023 Weibo User Development Report, Weibo user has reached 603 million. Microblog can not only greatly display the communication characteristics of new medium, such as personalized and strong interaction, but also better meet the needs of the audience, and to a certain extent provide a better platform for the media to disseminate information and collect feedback from the audience. Therefore, combined with the development environment of the new medium era and the advantages of Weibo itself, these people will choose Weibo as the main research position to discuss. And the concept of this article is Olympic health communication, but there is correctly no particularly clear definition of Olympic health communication. Therefore, this article combines literature analysis and case analysis to elaborate on the definition of Olympics health communication. First, from the perspective of Olympic health communicators and organizations, sports core organizations played a leading role in the process of Olympics health communication and are powerful promoters of Olympics health communication. Second, individual sports organizations make the Olympic Games and sports health communication more connected and systematic. In addition, sports athletes are also the main force for the expansion of the influence and communication of the Olympic Games. We can see that the International Olympic Committee and the Olympics organization and individual sports organization or athletes have formed a top and down Olympics health communication organization system and are systematically and prospectively promoting Olympics health communication. Secondly, the main content of Olympics health communication. The main content is drawn from two aspects. First, the Olympic Health Agency. The International Olympic Committee has said the success of Olympic Games is largely determined by the legacy it leaves to the world. Therefore, the concept of Olympics Health Agency was proposed at the Lausanne First in Switzerland in 2002, and is defined as the Olympic Games has a lasting effect on the health of the host place and even the whole country. That is, the promotion and improvement of the health policy, health environment, and health service of the host country or city, as well as the impact of public healthy concepts, healthy behaviors, and conditions through hosting the Olympic Games. From the definition, it can be determined that Olympics Health Agency constitutes the main contact of Olympic health communication. According to the investigation of the impact of the Olympic Games on population health, combined with the deliberate of the infect time, 2万年 divided the Olympic Health Agency into 4 types. Individual residents or grids, healthy service delivery system, and the external environment of the health system, and the last one is healthy external environment. From the classification point of the wing, the Olympics Health Agency is mainly based on the health community content. In addition to sport agency or health communication content, sports heterology is based on the content of sports health communication. According to this above classification of Olympic Health Agency and the relationship with other classification, the Olympics health communication can be classified in 2 characters. First, the content of health communication, mainly the construction of particular public health facility, health knowledge, education, and popularization. The second is the content of sports health communication, which is related to Olympic Sports Agency, including the content of health communication includes the following 5 aspects: improving the environment, establishment of public health system, and the establishment of health-related policies, improve media coverage of health-related topics, effective communication to the public, and positive physical activities are atmosphere through agency setting by this media. And the fourth is health education and health promotion. And the last one is improvement of social and cultural atmosphere, change the social and cultural atmosphere, and constitute the external element of the health operation system. Secondly, the content of sports health communication is mainly related to sports healthology. It mainly refers to that on the base of sports policy, such as National Fitness, Health China, Sport Power, and other strategies. And the next one, from the way of Olympics health transmission. First, the capacity of healthy service has been improved. And second is the improvement of health system and healthy external environments. And the third is changes in through and behaviors. In this study, the third approach is mainly studied. Finally, for the audience of Olympics health communication, Fu Hongpeng and Edward divided the audience of Olympics health communication into two levels. The first level of audience is resident and grassroots organizations and other stockholders, older people, college students, secondary school students, neighborhood community. The second level is government, communities, school. At the same time, according to the first article of the Olympics Health Agency classification, it emphasized that the audience of Olympics health communication is mainly the first level of audience. That is, residents and grassroots organizations and other stockholders. Furthermore, the Olympic Agency got studied that during the 5 years leading up to the Games, the host city, regional country, and its citizens are the protagonists of the agency story. Therefore, it can be concluded that Olympics health communication audience can be specific to the residents of the host city or country. According to the above analysis and synthesis, combined with Zhang Yean and Liu Qiang's definition of sports health communication, Olympics health communication can be defined as, with the Olympic Games, winter and summer, as a medium career theme or means, the International Olympic Committee, the Olympic Organization Committee, individual sports organization, and athletes as the main communicators in order to improve the health literacy and health level of residents and individuals in the host country and improve health behavior for the purpose of producing, transmitting, and sharing health knowledge and information, as well as a series of communication activities of sports health knowledge and information. Next is the third part of the thesis, communication strategy analysis. First of all, I would like to introduce the source and basis of data collection. According to the Olympic Charter, I selected two official papers, namely at Beijing 2022 Winter Olympics and the Olympic Games, as the data collection objects. A total of 1,750 papers were collected from this date. Combined with above analysis and keyword summaries of the main content of Olympic health communication, the following search basis table is obtained. And there are four main forms of text for the content retrieved: plain text, images, short videos, and hyperlinks. Among them, the use rate of the first form is low, and the use rate of the combination of picture and text is the highest, because the picture has a characteristic of interviews and freshness. In addition, the rapidity and the vividness of the form of short video are also irreplaceable in the first two forms. Through the clicked right in the form of hyperlinks, you can understand the audience browsing and interactive behavior. In the content released, the main part of the Olympics health communication are as shown in the following figure. From the graph, we can see that the content above health external environment is the most placed. The second is health service place system. The last content is the individual residents and groups. And next, this paper sorts out the content published by the Weber according to the type of information efficacy. In mining refers to the needs of audience that the information mining meets, which are divided into 4 types: news, live broadcast, entertainment, and community. First of all, for news Weber, the official Weber of Beijing 2022 Winter Olympics Games covers all types of the main content of Olympics communication, such as reports on the construction status of Winter Olympics Village, the progress of venue construction, the promotion of ice and snow sports in the public, health information, air quality and environment testing, and the light of prevention and control policies are all involved. In addition, some real-time reports and cutting-edge information about the Winter Olympic Games are also included. News Weber cover a major position in the release of official Weber. Secondly, there are a few live broadcast Weber, and most of the content is about introducing and visiting the characteristic and the construction of venues. However, it's worth mentioning that in addition to the official language as the text content, the official Weber also adopted a more active language to guide the audience to participate in live interaction scenes. And besides, for entertainment Webers, the official interacted with the audience through close knowledge questions and answers and participation in the loyalty. This way of questioning not only increased the interest of interaction with the audience, but also enables the relevant, healthy information to be covered to the audience. In addition, the Ocean Weber mainly use polished language and platform expression as content transmission. Finally, for community Weber, the overall number of releases is more, most of which are based on the promotion of ice and snow sports into the community. And in general, in the health communication of Olympic Games, the official Weber mainly use picture and text pictures as the main body of expression in this form, which can maximize the communication effect of pictures and attract the audience while conforming to the trend. The content is dominated by the health environment and health service place system, and most of the content types belong to the new types. In terms of content, the health, external environment, and the healthy service supply system are the main body of the communication content, and the communication for individual residents and groups is less. In terms of types, all the news content still dominates. Entertainment content with interest and variety has been added. And under the background that social media has become a new plan for the communication of Olympic country, social platforms are becoming an important force to promote the healthy communication of Olympic Games. Where users are more interactive, they also promote the reframation of directive topics, which can bring greater social influence than traditional media. Also, the overall use of new and old media makes the form of Olympic health communication diversified and precise. There is still problem of single communication content. And based on the above problem, this study put forward some suggestions on communication strategies. First of all, science and technology and the Olympics. The use of science and technology to help Olympics health communication so that the communication content is diversified. Second, increase the content of communication in terms of physical activity, conditions, and climate policies knowledge literacy as well as individual and groups population, and the environment outside the health system. And third, in the effective use of Olympics health literacy. Moreover, it promotes the scanning of the communication content and integrates it more into live field of the audience. In the new medium era, social media plays an irreplaceable role in the Olympics health communication of Beijing 2022 Winter Olympics Games. The openings of social media enable all Olympic-related groups to speak out, showing a new age of global sharing of Olympic stories, enriching and even balancing the communication pattern demanded by the Olympic Committee and the media organization to a certain extent, makes the organization of Olympic culture more diversified and three-dimensional, inclusive, and elegant future, and forming a multi-dimensional space of Olympic health communication subject. The Olympic health communication in the future Olympic Games should also pay attention to the transformation of media ritual to lifestyle, on the basis of maintaining the Prussian communication of the original traditional media. Diversified communication should be carried out, and the Olympic health literacy should be effectively used to create a new form of Olympics health communication mode. The above is my paper report. Thank you for your listening.